Maybe I'm Ben's biggest fan because I'm his mom, but Ben was a wonderful person. He was very full of life, very athletic, very coordinated, loved to be outside, loved hiking, hunting, fishing. Super smart, read a lot, very social. He taught me, I think, more about myself and about the world than anyone I've known.
We heard from so many people how helpful he was. He was, more so than probably we knew up until that point, how willing he was to help someone out and didn't ask a lot of questions, didn't ask for anything in return. That was just his nature.
A few years before his death, Ben went fishing, and he was near another guy that was fishing by himself. And the guy yelled out to Ben that, he needed help, that he was stuck. And when the guy reached out to grab his arm, the guy slipped and was carried away by the current. And Ben, without even thinking, just dove in after him, even though the man had stopped breathing and he was unconscious. Ben was able to give him artificial respiration and chest compressions, then ran like 3/4 of a mile in his bare feet over a gravel road to hail down the fire department. He spent one night in the hospital and he recovered. That meant so much to Ben that he had helped this other person. Starting in his teenage years, he began to suffer from a mood disorder where he experienced periods of depression and anxiety. He also used illegal substances and alcohol to self-medicate and to try to manage. Eventually, he was diagnosed as bipolar, but that came so late in the disease process that by the time he received that diagnosis, I don't think it was timely enough for him to get the right treatment. In the year prior to Ben's death, we noticed that his behavior really changed. He appeared to enter a manic phase. Joel went to the mental health probate court to ask for an emergency medical transport. And when he was discharged, he was given, a sheet of contact numbers for setting up follow-up outpatient. He was given medications, but he was non-compliant. When we went back to the mental health probate court, we said, look, he's non-compliant, his condition is deteriorating. We're afraid that he's a risk to himself or to other people. And they said they do zero follow-up.
And we kept saying, Ben, something's wrong. You really need help. We can get help. There is help. But he just couldn't get there. Once he landed in jail, there didn't seem to be any hope of help.
So we could communicate every other day. After 20 days, all of his communication, commissary, photo, mail, and telephone privileges were revoked. They said that I was the victim because there had been some domestic issues in the home. If they're going to revoke communication, they're supposed to go back to the court, to the judge, for a review. That did not happen. They just revoked all of his privileges, not just with me, but with all of his friends. He was held in solitary confinement, so he was physically isolated. And he lasted 30 days, and then he killed himself. 2.5 months after his death, a friend received a letter that he had mailed from the jail after he lost his communication privileges. He stated that he was really struggling with solitary confinement, that all of his privileges had been revoked, that the food was terrible, he felt like he was starving. He was prescribed Zoloft, and that must have been prescribed by someone at the jail. But it's the wrong medication for a person with bipolar disorder. When the deputies came to our home to tell us that our son had died by suicide, they told us a very simple, sanitized version. They said, your son was brought his lunch, and an hour later we went back to pick up the tray, and your son was dead. There was nothing that could be done. Sometimes people just kill themselves. We asked, well, do you investigate these deaths? Do you do anything to try to prevent these types of deaths from occurring? And they said, we do our own investigation. We only look for evidence that shows that we did nothing wrong. I said, well, what about looking at things like medical treatment or his loss of communication? No, we don't look at any of that. Within 3 days of our son's death, we started to get messages from other inmates who were in solitary confinement cells near our son. They told a very different story of the death. They said that our son was served lunch and that he started to yell that there were mouse feces in his lunch. No one would respond, and he started to yell and scream and pound on the cell and saying that he was going to kill himself, and then he was ready to check out, and then he couldn't stand it anymore. And the other inmates heard it, and they all started to pound on the cells and yell for help to get the deputies to come, because they realized he was ready to kill himself, and no one would come. And when they did finally come, our son was dead. I don't think I'll ever be able to forget that he was calling for help and no one would respond, and that the people who showed the most compassion were the other incarcerated individuals being held in solitary confinement, that they could show more compassion towards our son and towards us than the people who were staffing the jail and the investigation.
He spent 50 days in Oakland County Jail in solitary confinement, and he hung himself in his solitary jail cell on March 1st of 2024. I miss him every day. And you can't predict how any given day is going to go.
It's really drawn us into the work of criminal justice reform, because we realize that this happened to us, but this could happen to anyone. I don't care how privileged you are. I don't care if you're the President of the United States. Mental health knows no barriers, knows no boundaries. I believe we can do better as a country, as a county, as a state. There's many examples of other countries and other states that have taken legislative action to limit the use of solitary confinement. I do not think that people are aware of the terrible human rights, civil rights, American with disability rights violations that are occurring every single day within our jails in prisons.
They're citizens, they're taxpayers themselves, they are humans, most importantly, and humans need to be treated humanely.